Hello everyone, I am Rishika Reddy from Group 37. So we've been working on the project Chatbot for Medical Queries for the past few months. Now that we've almost completed the project, let us quickly take a look at the demonstration along with the potential upgrades and the use cases. Use cases of the project. Symptom assessment. So this project allows users to input their symptoms about their medical condition, and it provides them an initial guidance on the possible causes and also helps them decide whether they should seek professional medical care or not. General health information. So, for people who are interested in gaining more knowledge about various health conditions or medications, this chatbot will provide them a detailed explanation for all of their queries. Appointment scheduling assistance. So, based on the symptoms the user provides, the chatbot will help the patients determine what type of doctor they need to see. So, this will assist them with booking appointments with a particular specialist. Medication. It can provide information on drug interactions, side effects, and dosage instructions. Mental health support. The chatbot could offer initial counseling and resources for common mental health concerns. Also, if an individual is quite worried about his or her health condition, using this chatbot sometimes might be a sigh of relief when their condition is not chronic. Remote areas support. So, in regions with limited access to healthcare, where there are not many hospitals or clinics, this chatbot could provide basic medical guidance for the public there. After hours support. The chatbot can be available 24/7 because it's a web application, and it can address non emergency health concerns when clinics are closed. Health education. So, for research enthusiasts, this chatbot provides general wellness advice and explanations of medical terms or procedures, making their work a lot more easier. Potential upgrades. So, these are the improvements that could be made to the project to enhance its services in the future. The first one is enhanced knowledge base. We can train the model on a lot more data sets to broaden the chatbot's expertise and improve diagnosis accuracy. We can also use web scraping and scheduling to constantly keep updating the data so that the chatbot provides answers which are factual. Language diversity. So we can implement support for multiple languages to cater to a global user base and overcome linguistic barriers. As of now, the chatbot takes the input query and gives the output only in English. So once we develop it with multiple languages, it could be used at a global level. Voice interaction. We can integrate speech recognition and text speech capabilities, allowing user to verbally describe symptoms and receive spoken advice. So this will be quite helpful for illiterates to give a detailed explanation about their symptoms. Visual diagnosis assistance. So we can enable the chatbot to analyze uploaded medical images such as skin conditions, x-rays, or other visual symptoms to aid in preliminary assessment. So this will help the chatbot analyze the condition in a better manner and give accurate results. Symptom severity assessment. This upgrade could potentially save lives by helping users determine when they need immediate medical attention versus when self care is appropriate. Geospecific health advice. So, based on the user's location, the chatbot will consider the local health trends, available resources, and the regional medical guidelines. And based on all these, it provides them an accurate response. So, this is the architecture diagram. So, first, in the user interface, we have a login page where the user is supposed to type the login ID and the password. And the login ID and the password, along with the object ID, are stored in the MongoDB database. So, if the user's credentials match with the credentials in the database, then the user is redirected to the main page where the user can type their query. So, if the credentials are not found in the login page, the user is asked to sign up. So, once the login is successful and the user enters the query goes to the embedding layer. So, we'll be using all MPNet base v2, which is a transformer model for vectorization of the input query. And then this query goes to the RAG system where we have the data set stored in index.pickle and index.faiss files. So in the very beginning, we have taken 6 different data sets, passed them through a recursive character splitter to divide them into multiple chunks. And these chunks have been passed to the Hugging Face embeddings, which uses the all MPNet base v2 model and converts these data sets into vectors. So these vectors are stored in two files, the index.pkl file and the index.faiss file. The index.faiss file has the actual vectors, whereas the index.pkl file has the IDs to these vectors. So once the input query is vectorized, it goes to this RAG system and finds for similar chunks from the index.faiss file. And then later this vectorized query plus the chunks that we've taken from index.faiss file are given to the LLM. So we are using Mistral 7B Instruct v2 as our large language model. We've tried many other models like Bloom, but Mistral 7B is giving a more detailed and accurate response, so we've been using this. And then this model generates a response which goes back to the user interface with the help of HTTP requests. We are using React for the front end and Flask for the backend connectivity. This is the workflow which has more details about how the question is vectorized and then how the answer is retrieved from the model. So yeah, here is the demonstration of the project. Let us log in. Before that, we'll sign up with the details. Let the username be Rishika Reddy. Then goes the email. It's asking us to include an @ for the email too. Then the password. Yes. And now let us log in. So it's storing all these details in the MongoDB database. So yeah, here is the web page. So first let us type hello. As you can see there on the top, it is randomly giving us a few health tips also. So yeah, hello, I'm an AI medical assistant designed to help and answer health and medicine related questions. How can I assist you? Now let us ask, what are the signs of osteoporosis? It is taking nearly 20 to 30 seconds to generate the response. Though the duration is little longer, the answers it's giving is quite accurate. Osteoporosis is a condition characterized by weakened bones. The signs include back pain, loss of height, and then bone density tests are used to diagnose osteoporosis before symptoms appear. So yeah, the answer appears to be quite good. Let us ask how to treat it. So as you can see here, we've included sessions too. We need not mention the word osteoporosis again and again because it's taking the context from the previous question itself. So yeah, treatment depends on the severity of the condition. Then lifestyle modifications, smoking and excessive alcohol consumption, medications like rankligin inhibitors and may be prescribed to strengthen bones and reduce the risk of fractures. So in severe cases, surgical procedures may be used to repair damaged vertebrae. Consult with a healthcare professional for a personalized treatment plan. So it ensures the safety of the user also, because in the end it's asking the user to consult a healthcare professional and not to use the medication directly from the chatbot's response, which is good. Ask it an ambiguous question. I think I got the blues. Is there a vaccine or vaccination for this? So here the word blues is generally used to address a person with who's quite depressed or sad. But here we're trying to use the word vaccination to confuse the chatbot. So let's see whether it's able to crack this trick question or not. As you can see the health tips on the top. Sorry, but I can only answer questions related to health and medicine. This question appears to be outside my area of expertise. There is no vaccination for blues, which is a term used to describe feelings of sadness. The treatment options include therapy, medication, and lifestyle changes. So here the chatbot knows that the correct meaning of the word blues. So it's not getting confused, and also it is explaining the user that it can only answer questions related to health and medicine. So yeah, it is able to answer ambiguous questions too. And now let us ask it a real life scenario as well. My 3-year-old kid accidentally swallowed a coin. What should I do? Yeah, if a coin is swallowed, it typically passes through the digestive system without causing harm. However, if they experience vomitings, abdominal pain, seek medical attention immediately. So yeah, it's giving the user some tips, and also it is suggesting the user to go to a doctor if there is a severity. So yeah, it has given an initial assessment of the condition here. Now we can log out by clicking the log out button here. So yeah. So as you can see, the chatbot is able to understand some complicated medical terms as well, such as osteoporosis. And also it has given us what are the symptoms of it and also the treatment for that particular condition. And it is also able to answer ambiguous questions, and it is being very clear to the user if it is not clear with the answer, and it is also able to answer real life scenarios just like we've given the example here. So yeah, it is able to cover all the domains and give proper responses for most of the questions. Thank you.